Stringfield, who is the program director of the BSN program director for the School of Nursing at Tennessee State University. And of course, Dr. Stringfield, before we had our first commercial break, we were talking about nursing from a national point of view, and I think you indicated that nurses are more than nurses as we traditionally think of them, that they are really and truly health care workers. And so let's just sort of continue that in the sense of giving you an opportunity to talk about the BSN program that you had at Tennessee State University, and talk about that program.
There's nothing better in the world I'd like to talk about than that program. Our program has been in existence since about the mid-'80s, a little bit before the mid-'80s. It came about, the BSN program came about as a result of the union between, or the merger between University of Tennessee, Nashville and TSU back in 1979. The BSN program developed shortly thereafter. The associate's program was already there at the university. But the BSN program has gone through some changes over the past few years, positive changes. And right now what we're seeing is fantastic. We have with us faculty who are experienced at what they're doing. We know they're knowledgeable because when the students go out and they pass boards and we come back with pass rates of 94%, 96%, 97%, that speaks well of our faculty and what they have taught. It also speaks well of how well the students were able to learn that information. Our faculty are involved in a lot of community activities. We have one faculty member who is working with children and the problem with STDs. We have another who's dealing in the community with dealing with diabetes. Another one is very interested in and does some work with geriatrics. My particular interest is community education, and what I particularly have done with that is to work in the Preston Taylor Homes area for a while and taking the students out there with me so that they can learn more about community education. And we would do health sessions for that community on Saturdays. Haven't done that very recently because of the fact that the people are moving out of that area. As we know, they are tearing the area down to hopefully replace it with some, with what they say.
Scattered house.
Right. So that's what I'm looking forward to, that being completed and going back into the neighborhood and restarting this. We have two different organizations within the School of Nursing for students. One is the Tennessee State University Nursing Student Association. That is a chapter of the National Student Nurses Association. The students learn more about nursing. They learn through this organization. They learn to network with nursing students across the United States. And I think that networking is very good for them because they find out that, hey, this program is tops.
Oh, good.
And that's what I heard when with the last group that the school sponsored for the national convention for that organization. When the students came back, they were revved up and ready to go. These were some of our junior students. They were revved up and ready to go, and they said, Dr. Stringfield, and they talked with other faculty members, Dr. Stringfield, it was fantastic. We learned that we have an excellent program here. We go out complaining, but when we talk to other programs, other students,
you've got an excellent
we have to
program.
keep our mouths shut. But I think the students speak well of the program. We have a good hire rate with our graduates. At graduation, by the time our students graduate, I would say about 80 to 90% have been offered jobs. Those who have not been offered jobs have not applied for jobs. So that speaks well for the program, as well as the pass rate on the NCLEX exam, which is a national licensing examination that all nursing students have to take in order to become registered nurses. Other things that are going on within the program, we're doing distance education, and we will be starting that hopefully next summer. We are working through different things with Volunteer State Community College and Columbia State Community College in offering our RN to BSN nursing program there. The RN to BSN Career Mobility Program is one wherein the RNs in the community who do not have the BS degrees want to come back to earn a BS degree. We have been centered right here in Nashville for the longest time, and Columbia was the first to come to us and say, look, can you do this for us? So we said, yeah, we're not going to turn down anything. Not of that nature when it comes to teaching, no. So we have been in negotiations, so to speak. It's not negotiations, it's just a matter of working out how we're going to present our classes. And Dean Anima and I are working very closely together to look at various ways to take our courses down there without those students having to come here.
Okay.
So next summer, hopefully that will be in place. We will have distance education classes for our RN to BSN program at both Columbia and up at the Ball State area. That announcement should go out pretty soon in the newspapers. We have moved our education, placed rather a community focus into our program so that our students are right up there with everyone else across the nation in learning that healthcare doesn't just take place within the hospital. There is a community. They look at the organizations that most of the faculty volunteer with, such as the American Heart Association, the the Cancer Society, and so forth. And the object is for them to go out and find out what these organizations are about. Who are the personnel? What criteria do they need to work there? How do those organizations interact with the community? How do they impact the community? What is their reference point with the community? And we are working it through the entire program that all of our clinical courses would have that community component, to start out very basically with what I've just said, with our very first nursing course, such that when they get to their senior year, their very last semester, they are looking at the policies, the policy makers, and the impact of those policies on those who are the beneficiaries of health care. I believe that our program is offering our students as much, if not more, than any other program across this United States.
Well, I think it certainly takes a broad vision in reference to nursing, and especially that community approach. And as a matter of fact, I think in almost every professional area, the complaint has always been that students know quite a bit about the academics of it, but they don't know very much about the people involved in it. And I think that to carry health care as you're doing back into the community, and to and I think especially, and this is one of the things I'd like for you to comment upon when we come back after this second commercial break, but I think especially the outreach efforts that you're doing, and I'd like for you to talk about that some more, and to especially talk about those individuals who might be listening this morning, who perhaps would like to become involved in nursing, either from the AA program or whatever program, and you could give them some kind of information as to how they might be able to do, even those who might not be qualified at this particular point, what they have to do. And let's do it from that particular perspective.